अशी अजून कारण तुमचा लाईट ब्लॉक होतो. हे क्वेश्चन्स तुम्हाला हवेत ना रेफरन्सला?
Tell me when to start. A very happy Mental Health Day to all of you. Today is World Mental Health Day, and we are celebrating 25 years of World Mental Health Day celebrations. The World Mental Health Federation announced this day in 1992, and the whole purpose of celebrating mental health, mental well-being, as well as creating awareness and decreasing stigma for the same was done because there was a lot of confusion about mental health. What encompasses mental health, and what really leads us to problems with regard to mental health. All of us have mental health issues. Then how are they different? Why should some people need help at some point of time in their life, and why should some people go through life without any mental health issues? So there was a lot of confusion regarding this, and a lot of stigma related to approaching a mental health professional. And therefore, to create awareness, decrease stigma, and increase help-seeking behavior, the World Mental Health Day was begun and celebrated now worldwide. It is ironical but very sad that India has been proposed as one of the most depressed countries by the World Health Organization, and almost 1 in 6 according to some estimates and 1 in 10 according to other estimates of Indian people are significantly depressed. Now, what is depression? All of us get depressed at some point in time of our life. All of us feel sad, all of us feel unhappy, all of us have certain life events which make us feel unhappy. Now, depression is just one of the many mental health issues that we have to address. And why is clinical depression different from other depression? Why are mental health issues not just depression? Depression is an umbrella term for a lot of mental health issues. There could be bipolar disorder, there could be schizophrenia, there could be OCD, there could be several anxiety disorders like panic disorder, phobias, and several other life events that can trigger off trauma and post-traumatic stress disorder. So it's not just depression. Depression is just a general term that is used for mental health issues today. Now, what we need to know is that in our country, most people who are depressed or who have mental health issues are in the productive age of maybe 30 to 40, 45 years. The average depressed Indian is 31 years of age according to the recent NIMHANS survey. So it's very important for us to deal with depression, not just depression but other mental health issues, not only for the person himself or herself, but also for a host of other reasons like economic liability that our country is facing because of these issues. So many medical complaints, so many physical issues are actually having a lot of mental health contributions. So many heart and BP and diabetes related issues are actually related to underlying mental health issues that could be addressed, and all these physical ailments could be avoided. We need to know that mental health issues are growing over time. It's not just the awareness that has improved and therefore we know about many mental health issues, but it's also that actually a lot of sleep disorders, suicidal behaviors, depression, anxiety disorders, as well as drug abuse and substance abuse issues have increased. Why they have increased? There are a lot of mental health is extremely sensitive to societal changes, environmental changes, and therefore, like so many other illnesses, so many other physical ailments, mental health issues have also increased in, the prevalence has actually increased. So I am getting a lot of questions actually. What are the signs of depression? How can we understand who is depressed? How can we understand if somebody needs a mental health challenge? So I've got a lot of questions from Agam and Pranoti and Ketki and Kabir and Alfi, Rishikesh. Let me answer all these questions quickly first, and then I'll take each question. Like I said, depression as well as most other mental health issues are on a continuum. All of us feel sad sometimes. When is it that we need to pay attention to this sadness? There are certain signs and symptoms. There are certain things which you can notice to help your peers at the workplace or your peer group in your college or your relatives or family. The very fact that now people are talking about mental illness is that there is at least one member or two members in the immediate family or extended family or peer group who is actually affected by mental illness. And therefore we are talking about it more and more. It is very sad that after we notice these things, it's being talked about. We could have prevented it if we would have taken it seriously a few years back. So now what can you do? So suppose there is a person who is having significant sleep and appetite disturbance for at least 2 weeks. That is a lot of sleep or significantly decreased sleep or a major sleep disturbance. Significant increase or decrease in appetite, significant increase or decrease in weight in the past few months is a significant sign of a mental health issue. If there is a loss of interest in most activities previously enjoyed, suppose there is a significant low mood, withdrawal from social activities, general sense of being fed up or resigned to fate. Also, in some cases, maybe not depression, but in other disorders and illnesses, there is a tendency to feel very confused, in doubt. There is a general feeling of being some unreal things going on in the environment. There are sometimes repetitive thoughts that people have. They know they are illogical thoughts. We call them obsessive thoughts or obsessions. It can happen to anyone at any time. It is not as if these people are different and you are different. It can happen to you, it can happen to me, it can happen to anyone. It's a difficult phase of life. It can happen to anyone. So we need to be very sensitive to these parameters. And this is how you can help out a peer simply by listening actively to a person without giving unnecessary advice. Sometimes we tend to give advice and we come across very funny advices that people have given their colleagues. Go and have a drink, you'll feel better. Or just forget it. Or leave your job, everything will be all right. Or change the place of your residence, maybe it is not lucky for you. This will not just create more problems, but it will actually increase the problems that the person is facing. So rather than give any advice, it is a very good idea to actually properly listen to the person. If he is facing the symptoms that I have just mentioned just now, it is a good idea to approach a mental health professional. Whom to approach is a big question, and there is a major deficiency of mental health professionals in our country. We have not more than 1 or 2 mental health professionals for 2 to 3 lakhs of people at this point in time. It is really sad, and most of these few thousands of mental health professionals are all concentrated in big cities. So we need a lot of help, and I really congratulate Volbicon on their initiative about online counseling, which is going to be, I'm sure it's going to be a big hit with the new generation, and I think it's the need of today's times. Our mental health professionals are people who are well qualified. We have psychiatrists, psychologists, and psychiatric social workers. These people should be well qualified. They should have a the highest degree of qualification that should ideally be there for mental health. These people are licensed, or they are people who are professionally qualified in clinical psychology or psychiatry. Please do not approach a person who has a few months of some counseling degree, because I'm not saying that they are bad or they are problematic, but they are not well qualified to treat clinical issues. So please be careful while approaching. Please check the credentials while approaching a mental health professional. Counseling and psychotherapy is not a fun activity. It's a serious activity. So I would urge psychologists and counselors also to take it extremely seriously, not to play personality games on the net, not to send out questionnaires which can be answered by common people and label them as bipolar disorder or anxiety disorder. It's a very serious matter. Please do not label and take this field so lightly. Now let me address some questions that have come up. Since the theme of the World Mental Health Day 2017 is getting the shadows out of the workplace, the mental health shadows out of the workplace, I think some of the questions are with relation to the workplace. Ketki has asked, can you give me some tips to lead an emotionally healthy life? How should people take care of themselves? Mr. Manohar has asked that question. Also, is there a way to protect myself from mental health issues? I think these are very relevant questions, focusing on prevention of mental health issues. Some of the very simple tips for mental health and mental well-being are to lead a proper routined life. To have a structure and routine to the day is something that cannot be replaced by anything else. Having a goal in life is probably one of the best things to contain any kind of mental health issues. Having a goal, having a meaning in life, and searching and re-evaluating these meanings continuously is one of the best way to prevent mental health issues. However, there are still some mental health issues which will creep up, which will come and trouble you. Rather than get affected by them, or rather than feel bad about why did I get this mental health issue, it is a good idea to seek help and resolve it, because most of these issues are actually completely treatable. And I think that answers some of the questions that have been asked also. Are these issues treatable? So these issues are completely treatable to a large extent. There are some issues which may not be completely treatable or completely cured, but you will be able to deal with them, accommodate them, and live a good quality of life. Tabassu has asked, do any of the mental health issues have a genetic vulnerability? Yes, some issues do have a genetic vulnerability. Like your heart disease has a genetic vulnerability, but that doesn't mean that if you have a family history of heart disease, you are sure to get it. It's not like that. It's not such a direct proportion. There is a vulnerability, and if you have a vulnerability, it is a good idea to be aware and alert to any possibility of a mental health issue. But most issues are not directly genetically correlated. Mental health, unfortunately, is more complicated. It's not as direct as some other physical ailments. It is very complicated. It is, like I said, very sensitive to societal changes. It is very sensitive to what is happening in the external environment and your perception and coping with that. Prajakta says, are there any mental health challenges specific to any age group or life stage? Definitely. There are, for example, in an older age group, we find more neuropsychiatric problems. There are problems with memory, there are problems with there are other cognitive decline related issues. There are also issues in the elderly because of loneliness and because of a lot of medical issues that they are already facing. So it's a complication between medical and psychological issues. For younger age groups, people who are really struggling to make their career and settle down in life. There are several issues in this transition phase. I see a lot of clients between 18 and 25 or even 30 who are really going through a lot. One feels really bad looking at the amount of stress and the amount of multiple stress they are facing, and still dealing with it quite well, despite the fact that they are feeling stressed out about it. Some of them approach us just to know how they can deal with it better. So they want well-being, not just alleviation of their stress. Suhani, you've asked that, are there any ways to deal with a mental health issue other than medication? Please suggest me something relevant to my situation. Yes, definitely. Medication is one way to cope with stress, and whenever medication is required, please take it judiciously. Don't really feel too worked up about taking medicines, because the kind of medicines available now, and psychiatrists are best people to talk about it actually, are very sophisticated medicines. So don't feel shy about taking medicines. However, besides medication, there are a lot of other techniques that psychologists use to deal with stress, as well as burnout at the workplace, as well as a lot of other mental health issues. We have specific techniques that we teach you to deal with your own problems yourself. The whole idea with which a psychotherapist works is to help you deal with your issues and not make you dependent on any kind of treatment. Yes. Supriya has asked how to develop kids between 4 to 5 years. I think most young parents have a lot of issues, a lot of problems, especially because nowadays actually there is a little focus on migration and a breakdown in joint families. That is one of the reasons. Also, I appreciate a lot of young couples who are seeking expert help for bringing up their children. So we have a set of sensitive and well-aware parents who don't want to make any mistakes and want to deal and prevent mental health issues later on in children, as well as increase mental well-being in their children. One of the best things you can do for your children is to be with them, to spend quality time with them, and not really, the favorite word these days that most younger generation people use is don't judge them. So rather than really advising, warning, judging, or instructing them, sometimes a lot of instructions make children a little anxious. So it's better not to instruct them all the time. Let them be. Quietly observe, monitor, try to understand why they are behaving in a particular manner. Try to understand the kind of personality they are developing. Try to understand each child's nature, temperament, and deal with the child according to that temperament. So you will often find two children in the same family polarly opposite. And the very reason is that the very reason for parents to deal with them differently is because of their different temperaments. Neha asks, how do you decide that the normal stress and work pressure has led to mental health issues? Any specific symptoms? Yeah, like I outlined before, normal stress is no longer really normal at the workplace as well as anywhere else. It's always a combination. We are doing several things at the same time. We are likely to face burnout. Certain signs that will help us to decide when to approach a mental health professional. And these signs are, again I repeat because they are important, loss of appetite or a major difference in appetite, sleep, a difference in mood, significant irritability, any tendency to for high risk kind of behavior, as well as a withdrawal from social activities and previously enjoyed activities. Sometimes a confusion or repetitive thoughts is also a significant reason for approaching a mental health professional. We should not ignore self-harm, suicidal thoughts, even fleeting suicidal ideation, and not take it lightly at all. Yes. A lot of questions that have previously come up are related to alcohol use, substance abuse, which I think is really on the rise because people do not want to talk about mental health. There is a huge stigma. So if I'm upset, I'd rather have a glass of alcohol and not discuss my problems with other people, because maybe they will laugh at me, maybe they will call me names, or maybe my boss will actually give me lesser work, or feel threatened that if I have a mental health issue, maybe I'm not capable of working properly. And that is the stigma that all of us have to get together and kind of get rid of, because till we do that, there is really very less hope for us to get on with this field and mental well-being for all. Yes. I think finally I would just like to address the family, because for physical ailments also we need help from the family, more so for mental health. When we address the individual, we address the individual concerns, the work pressure, the study pressure, and whatever else the person is facing. But we need help from the family. I would urge organizations also to keep the family involved whenever there is a tendency for a mental health issue in any particular individual member, as well as for any group of members in the organization. Because when the family is involved, we have research saying that people get better sooner, faster. So we need the family involvement for that. Organizations can definitely help to create better and more sensitive, psychologically sensitive work environments. They can be a supportive environment where people feel safe to talk about feeling sad or getting strange thoughts. So if there is a supportive environment, if burnout is nipped in the bud, if there is a environment where people can approach for help, talk about it openly, and they get more and more active listening from their peers, I think nothing like it. We have actually reached the stage where we would like to. And I think workplaces are the best place for people to express themselves, because they are there for such a long time. And I think in most of our workplaces, especially in IT companies, etc., we have very educated people who are likely to understand the need for psychological help. And these are the people who will actually take this field ahead. Yes.
How would you talk about the role of society in general in developing mental health awareness or providing help for people who are facing mental health issues in a society context?
Yeah, in a larger society context, I think the first and foremost thing is to openly talk about mental health. People who have mental health issues and families who have members with mental health issues need to openly talk about them. Like we talk about a headache, or we talk about diabetes, or we talk about kidney trouble. We need to talk about mental health issues. The more we talk about them, the more we will realize that many people face similar problems. And then it will be like a community facing the problem together. There is also a need to create public awareness campaigns everywhere, right from villages, small towns. Now that we are, getting more and more technologically aware, and even in villages, there is no dearth of technology. There is a need to create mental health awareness everywhere. Our country has been one of the first countries to really take ahead the National Mental Health Program in the 1980s. And a lot of people are availing of the funding to do that, take it ahead. We need to really use these programs, use the funding that is available in our country for mental health purposes, and take this ahead. So I think that is one way, through campaigns, awareness, and correct information. Not spreading wrong information, not spreading stigma. The least you can do if you cannot create awareness is to not at least encourage stigma. So that is one of the best things we can do, to talk about not just mental well-being and positive psychology, which is also very important, but to also talk about mental illness and how to get it better with. So I think let's not shy away from talking about mental disorders. They are there, they are a reality, and we need to face them. and they are there everywhere, and all of us, it's not them and us, it is all of us are affected by it. So that is the way I think society needs to actually deal with it, by facing it right in the face and by dealing with it directly.
Ma'am, what are some of the factors that make one more vulnerable to mental health issues than any other person?
Yeah.
Are there any?
Yeah. Some of the factors that can increase vulnerability are significant trauma or a loss of a significant person in your life, especially while you are very small, and the loss of a parent can be a very significant factor when you are a child. Some of the things are, like I said, trauma. Second is genetic vulnerability. There can be 2, 3, 4 life events at the same time, which can actually create a major amount of stress and a burnout. So it's like a live wire. If there is continuous stress, there will be a burnout. Okay.
So, how do I protect myself from having mental health issues? Is a common question that all of us have.
Yes. First of all, don't get scared of anything. I think one of the best things to do is to prevent anxiety. Because in most mental health issues, anxiety is always there in the background. What will happen if I have this problem? What will happen if when it comes, we'll see. I think that is the attitude that most of us need to have. Secondly, like I said, a proper routine, a structure, and a meaning in life normally prevents most mental health issues. And if there is a mental health issue, try to deal with it head on. Don't push it under the carpet. Talk about it. Reach out to people. So the issue will not really snowball into something really big. So we need to nip it in the bud. We need to control it while it is there, and not shy away from it. If it has to happen, it will happen, and we'll get done with it very soon. Yes. Yeah. Okay. I have 1 or 2 more questions actually over here. So Priya has asked, how could couples have better communication? With the changes that are happening all over the world, and with individuals getting more and more stressed out, also with some decrease in the frustration tolerance capacity of people these days because of the stressors, couples are also facing a lot of problems. I think there is no tip that one can really give for everything, but one of the things that we can do is to learn to tolerate each other a little bit more, to learn to communicate more effectively. That is something that can be actually done in terms of premarital counseling, or even while people are very young in their adolescence or early adulthood, wherein they can learn how to deal with other people, they can learn to accommodate them, and they can learn to give them more space. I think this will help to increase better communication. So if we start with early childhood and learn to teach people mental hygiene, then probably these issues will be resolved later on in life. Yeah. Do we take more questions?
Okay.
Yes. Yeah. If you have missed out anything that you want to ask, there are a lot of questions sometimes that come to us after the session is over. Feel free to post your queries and we will definitely answer you back. So there's not going to be any dearth of queries, I know, because this is a topic that everybody gets affected by. So please feel free and please help in decreasing stigma and increasing awareness. Thank you so much. Thank you.